Okay, so we're going to be talking about using the ankle as like a foot as a grounding, the plugging in from the tripod, and using the ankle control as kind of a pivoting action. So think of like a joystick. So your shin bone, your tibia, and the fibula there for control, and using your hip musculature and your core on top of it, and even your other leg. So I can kind of adjust based on that. Now, if you're dealing with a lot of pain or instability or balance issues, you may want to turn around in this scenario and use the wall for extra balance and support here. So something like this to help adjust. Okay, but I'm going to turn on so you can see me better, and I'm going to be here so you can better see and understand. So if I was using the wall, I would use my arms as well as I'm able to adjust all this so that you're stable and protected. So here we go. I'm going to go forward, backward. That's the most obvious, the easiest. You use that soleus muscle down low, the lower calf. Make sure that you're sitting back in the hip. You can twist and sit back there. Load that glute first. That's the bigger bucket. And then rock into the soleus. Make sure it's not painful or unsteady in the knee. And then you can also go a little bit side to side. Again, the wall's really helpful for these, especially not the ones that aren't forward backward. And then there's a little bit of, kind of twisting. And then you can also think about that back around to the back pocket, up and forward to the breast pocket. So you kind of do a little rotation. Again, don't twist straight through the knee. Don't overload the quads going down. You can use them more coming up. Those are things to keep in mind when you're doing these movements. You don't want to cause more pain or stress than you need to. Load the bigger, stronger muscles first, and then add in those smaller, weaker muscles and minimize the pain and the unsteadiness. So you want to make sure you have things covered, especially if you have injuries or have had surgery. You want to make sure you're protecting yourself. It's not that you want to stay weak forever, but you want to do it in a way that you're going to be able to progress safely and securely and do it the right way so that you don't end up with injuries or that you don't slow yourself down progression-wise. So then that can be progressed into maybe use a walker or something to help you along, and then just feel things out as you go.